Good morning. Thank you for having me. Again, I'm Shirley Ziton. I'm a second-year surgery resident at Broward Health in Fort Lauderdale, Florida. It is my pleasure to present to you our research on the implementation of EndoFLIP for anti-reflux surgery and its effects on postoperative outcomes. I have no disclosures to report. Our primary investigator is a proctor for Johnson & Johnson. There are no conflicts of interest as it pertains to this study. As we all know, the most common gastrointestinal diagnosis in the United States is gastroesophageal reflux disease. Symptoms are, heartburn, cough. Alarm symptoms could include dysphagia. Left untreated, can lead to Barrett's esophagus and cancers. We start off with lifestyle modifications for these patients, including weight loss or reduction of, spicy foods, lemons, chocolate even. If that doesn't work, we move on to proton pump inhibitors and other antacids. And when all else fails, we consider surgical intervention. The Nissen Fund application has been around for over 30 years. It involves a 360-degree wrap to effectively re-augment the lower esophageal sphincter, but this has been shown to be associated with dysphagia and gas bloat. So the partial fund applications, such as the Toupee, which is a 270-degree wrap, has been implemented in attempts to mitigate some of these side effects. More recently, magnetic sphincter augmentation has been deployed using a magnetic force to re-augment the lower esophageal sphincter. However, research has showed that postoperative outcomes are similar to that in partial fund applications. Functional lumen imaging is a catheter-based probe with a compliant balloon inflated to a fixed volume. This technology provides real-time information regarding the distensibility of the gastroesophageal junction and has surfaced to individualize anti-reflux surgery. High-resonance impedance planimetry provides measurements including the cross-sectional area, pressure, and distensibility of the esophagus and the gastroesophageal junction. It has been employed to calibrate crural closure in our fund applications. The objective of our study was to determine whether incorporating EndoFLIP into our practice would have an effect on short and long-term postoperative outcomes after anti-reflux surgery. This was a retrospective cohort study from prospectively administered Rohr's questionnaire that took place from October of 2016 to June of 2023. We implemented the EndoFLIP in December of 2020. We included patients that were greater than or equal to 18 years old, undergoing partial complete fund application or magnetic sphincter augmentation. We excluded patients that had history of previous anti-reflux surgery, were pregnant, or missing preoperative Rohr scores. Again, the Rohr's questionnaire was administered preoperatively and at 3 time points postoperatively: 3 to 6 months, 1 year, and 2 years. We included a total of 195 patients, 86 of which underwent anti-reflux surgery without EndoFLIP, 109 went with. 66.7% of our patients were female, with an average age of 64. Our primary endpoints were patient satisfaction, PPI use, gas bloat, dysphagia, regurgitation, and health-related quality of life. In this graph, and the ones to come, you'll find that the x-axis is time and the y-axis is one of our primary endpoints. The blue line represents scores prior to the implementation of EndoFLIP. The orange line is width. With regards to patient satisfaction, we found a clinically significant difference at 1 and 2 years, with higher dissatisfaction reported in the group without EndoFLIP, although this was not statistically significant. Patients with EndoFLIP reported a statistically significantly greater use of PPIs at 3 to 6 months postoperatively compared to without, with a p-value of 0.012. We did note a clinically significant reduction at 2 years, as you can see here with a 5% difference between the two groups. However, this was not statistically significant. We found no significant difference in gas bloat scores, And again, no significant difference with regards to dysphagia. Again, here we find at 3 to 6 months postoperatively, patients with EndoFLIP reported a statistically significantly greater greater report of regurgitation. We did not see the same trend at 2 years that we did with PPIs. We found no statistically significant difference in health-related quality of life at 2 years. EndoFLIP allows surgeons to individualize the crural closure during our fundoplications and anti-reflux surgeries. Although we did find improvement intraoperatively in our crural closures and a trend toward less PPI use and improved patient satisfaction, these were not statistically significant. We did only include patients from 1 out of our 2 surgical facilities. With continued analysis, we hope to demonstrate significant long-term improvement. We are also currently looking at comparing links or magnetic sphincter augmentation to partial fundoplication with and without EndoFLIP. Thank you. I will take any questions.